Teens and sexually transmitted diseases. Teens and sexually transmitted diseases. Did you know that over 50% of sexually active adolescents will get an STD by age 24 through some form of sexual activity? Most people who are sexually active do not realize that STDs are this common. Infections spread by sexual contact are called sexually transmitted diseases. There are over 20 kinds of STDs. Remember that not only vaginal sex, but also anal sex, oral sex, and genital to genital contact can spread STDs. Today we will focus on the most common types of STDs. Infections are usually caused by germs or microorganisms that are so small they can only be seen with a microscope. Infections are caused by viruses, bacteria, or protozoa. Many viruses cannot be cured because we do not have medicines that kill viruses. Bacteria and protozoa can usually be treated with antibiotics. Infections can spread from one person to another in different ways. Colds or the flu are often spread from one person to another by coughing or sneezing. Sexually transmitted diseases, or STDs, are spread through sexual contact or sexual activity. Many people are not aware of the facts about sexually transmitted diseases. Are you? No, sometimes the term sexually transmitted infections is used rather than sexually transmitted diseases. As most often used in healthcare publications, we have elected to use the term STD in this presentation. All STDs are caused by STIs. STDs are one of the most common types of infections in the U.S. today. Almost 19 million new cases of STDs are estimated to occur in the U.S. each year. You can even get an STD the first time you have sex. You can't tell if someone has an STD just by looking at them. Most people with STDs are unaware of their infection and go unrecognized and untreated. And to make matters worse, some STDs have no cure. Sadly, most infections are in teens and young adults who have become sexually active without knowing the facts about STDs. Most people who have an STD don't even know they are infected. The sexually transmitted organisms in their bodies are in their bodies, but they don't have any signs or symptoms. No sores, no blisters, discharge, or pain. We say they are asymptomatic. They have no symptoms. However, they can still spread the infections to their sexual partners. STDs are not just nuisance problems. They can cause serious health problems. If you get an STD, there is no way to predict if you will have serious health problems and or suffer severe lifetime consequences. As we will discuss, there are STDs that can cause severe pain in the genital area. Two common STDs can cause infertility, meaning you can't get pregnant in females. A viral STD is now known to cause some types of cancer. In the U.S., thousands of people die every year from serious health problems caused by STDs. STDs can also cause emotional problems. Teens are at greater risk of getting STDs primarily because over time they have sex with many different partners. Also, the adolescent cervix, the bottom part of the uterus, has not matured and is more easily infected with some STDs than the cervix of a much older woman. We also know that if you have certain STDs, it is easier to become infected with HIV. Many STDs cause damage to the genital skin, allowing HIV easier access into the bloodstream. Even babies can be born with an STD if their mothers are infected during the pregnancy. All of these factors have contributed to STDs costing billions of dollars in the United States. STDs are infections spread specifically through sexual activity. Sexual activity is any contact with the genitals, buttocks, or breasts for the purpose of sexual stimulation. Sexual activity by law includes other activities besides vaginal sexual intercourse. When people talk about sex, they are usually referring to sexual or vaginal intercourse where the penis is placed inside the vagina. Oral sex is when the mouth of one person touches the genitals of another person. Anal sex is when a penis is placed inside the anus or rectum. Outer course is genital to genital contact without penetration of the vagina by the penis, sometimes with ejaculation occurring near the vaginal opening. As you can see, the term sex includes much more than just vaginal sexual intercourse. Teens need to understand that whether it's oral, anal, or vaginal, it's all sex. Let's look at diagrams of the male and female genital systems to see how STDs can infect the various parts. Some STDs can affect the inside of the urethra and the penis and travel to the prostate gland. Rarely, they can also travel through the vas deferens to the epididymis and testicles. STDs can also infect the skin of the penis and scrotum. STDs can obstruct or block the fallopian tubes, preventing fertilization, or cause scarring, which can trap a fertilized egg, causing a tubal pregnancy. This can be a life-threatening situation if not diagnosed and treated promptly. Many women also suffer from pelvic pain as a result of the damage to the reproductive tract caused by an STD. STDs can also infect the cervix, vagina, and outside skin folds, the labia or vulva. This slide lists only a few of the most common STDs. There are many more. Which ones are curable with antibiotics? That would be bacteria and protozoa. Which ones cannot be cured with medicine? Those are the viruses. Let's discuss a few important facts about each STD. Chlamydia and gonorrhea are bacterial infections caused by Chlamydia trachomatis and Neisseria gonorrhea. These infections can be treated with medicines called antibiotics, but only if the sexually active person goes to a clinic to be tested and is found to be infected. Most people infected with these bacteria do not know it. They don't have any symptoms and can pass chlamydia and gonorrhea to others during sex. If a male has symptoms, he may have a yellow pus coming from his penis and burning when he urinates. In women, chlamydia and gonorrhea usually infect the cervix, the bottom of the uterus, but can cause a severe infection called pelvic inflammatory disease if they travel through the narrow opening in the cervix to the uterus, fallopian tubes, and ovaries. Untreated chlamydia or gonorrhea can cause serious problems. In women, chlamydia and gonorrhea are the common causes of pelvic inflammatory disease. About 1 million women each year in the U.S. develop PID. Women with PID do not necessarily have signs or symptoms. PID can lead to internal abscesses, which are pus pockets that are hard to cure, long-lasting pelvic pain, and infertility. The bacteria can damage the fallopian tubes enough to increase the risk of ectopic pregnancy, which is a condition in which a fertilized egg grows outside the uterus, usually in the fallopian tube. When a woman becomes pregnant, the fertilized egg must travel from the fallopian tube to the uterus. The baby can only develop and grow normally in the uterus. If the fertilized egg gets stuck in the fallopian tube because of damage and scarring possibly caused by chlamydia or gonorrhea, the pregnancy cannot develop normally and the fetus will die. Just like with many other STDs, a person with chlamydia or gonorrhea can more easily get HIV if they have sex with someone who has HIV. If the chlamydia and gonorrhea bacteria travel from the vagina through the cervix into the uterus and fallopian tubes, they can cause pelvic inflammatory disease. Girls who have PID may have mild to severe lower abdominal pain with fever. The infection may be so severe that the fallopian tubes are filled with pus. It is often necessary for girls with PID to be admitted to the hospital and given intravenous antibiotics. If the fallopian tubes get infected, the infection can be treated, but the tubes may be permanently damaged with scar tissue. The tubes can be partially blocked, causing a fertilized egg to get stuck in the tube, resulting in an ectopic pregnancy. These tubes are not meant to hold a growing baby. When the pregnancy gets too big, the tube can rupture, causing pain and bleeding. Surgery may be necessary to remove the tubal pregnancy and stop the bleeding. In some cases, the fallopian tubes may be completely blocked, preventing the egg and sperm from ever meeting. This inability to become pregnant is called tubal infertility. A woman who is wanting to have a baby may not be able to get pregnant if she developed PID that caused scar tissue blocking the fallopian tubes. In some women, PID causes chronic pelvic pain for years. In summary, PID caused by chlamydia and gonorrhea can be a very serious disease in females, leading to tubal pregnancy, pelvic pain, and infertility. If you're having sex, you should see a healthcare professional such as a doctor or a nurse to get tested for chlamydia or gonorrhea. You could be infected and not know it. As we will discuss, condoms decrease but do not eliminate your chance of getting chlamydia and gonorrhea. Abstinence from sexual activity is the only 100% effective way to prevent chlamydia and gonorrhea. Syphilis is a complex STD caused by the bacterium Treponema pallidum. In its early stage, syphilis causes a painless sore on the male or female genitals or other areas of the body. Later stages involve a rash on the hands, feet, or other areas of the body and infection of other body organs, the nervous system, and heart. If syphilis is not treated in its early stages with antibiotics, it can cause serious problems by damaging the nervous system and heart. Most infections are found before significant problems can occur. If a pregnant woman has syphilis, it can be transmitted to her unborn baby, causing serious health problems. Such infections among infants are largely preventable if women receive appropriate diagnosis and treatment during prenatal care. All pregnant women should contact a healthcare professional as soon as they know they are pregnant. All pregnant women are tested for syphilis early in pregnancy and, if infected, treated immediately with antibiotics to prevent serious health problems in the baby. While the health problems caused by syphilis in adults and newborns are serious in their own right, it is now known that genital sores caused by syphilis can also make it easier to transmit and acquire HIV infection through sexual activity. Anyone who is sexually active and has a sore or blister on their genital area, whether it is painful or not, should see a healthcare professional and be tested for STDs. As we will discuss, condoms decrease but do not eliminate your risk of getting syphilis. Because syphilis is transmitted through all forms of sexual activity, abstinence from all forms of sex will ensure you will not get syphilis. Trichomonas vaginalis is a microscopic parasite. This protozoa infects the vagina and cervix in women and is located in the urethra in men and women. Trichomonas is one of the most common causes of a vaginal discharge in women. Males infected with trichomonas usually do not know they are infected because they do not have a discharge or any other symptoms and unknowingly spread it to females during sex. When a female is found to have a vaginal infection caused by trichomonas, it is important also to treat the male sexual partner to prevent reinfection. Women who have trichomonas may be at increased risk for pelvic inflammatory disease, which can lead to serious health problems as discussed earlier. If you're sexually active and have a heavy discharge from the vagina, you should see a healthcare professional and be tested for STDs. As with other STDs, condoms decrease your chance of getting trichomonas. Abstinence provides 100% protection from trichomonas. Herpes is an STD caused by a virus called herpes simplex virus, or HSV. In some people, it causes painful blisters and sores on the genital area. Most people who get the sores and blisters will get them again and again because the virus stays in their bodies for the rest of their lives. While there are no medicines to get rid of the herpes virus, medications are available that can prevent the sores from coming back, but you have to take the pills every day. If you stop taking the medicine, the sores reappear. Most people who get herpes will get it from someone who has no sores or blisters. In fact, most people infected with herpes don't even realize they have the virus. Once a person has herpes, the person can pass it to someone else during sex, even when sores are not present. Herpes can cause recurrent painful genital sores. Regardless of severity of symptoms, genital herpes frequently causes psychological distress in people who know they are infected. The infected person may be frustrated with the recurrent sores on the genital area. They have to deal with the fact that they can pass the herpes infections to others during sexual activity. If a woman has herpes and becomes pregnant, she must notify her healthcare provider. Herpes can cause serious life-threatening health problems in infants if the baby is infected during pregnancy or birth. Medications can be given to decrease the chance of the baby becoming infected, so it is very important to tell your doctor if you have herpes. In the United States, genital herpes may play a major role in the sexual spread of HIV, the virus that causes AIDS. Herpes can make people more susceptible to HIV infection because it's easier for the HIV to enter the body through the damaged skin. In other words, if a person has genital herpes, it is easier for that person to get infected with HIV if they have sex with a person who has HIV. If you're sexually active and have sores, blisters, or any other type of genital irritation that comes and goes several times a year, you should see a healthcare professional for an STD test. As with other STDs, condoms decrease but do not eliminate your chance of getting herpes. Genital HPV infection is an STD that is caused by the human papillomavirus. HPV is sexually transmitted and can infect the genital area, the skin of the penis, scrotum, vulva or labia, anus, vagina, or cervix, the lower part of the uterus. Genital human papillomavirus is the most common STD today. HPV can cause warts on the genital area. The virus can also cause abnormal precancerous cells on the labia, cervix, and anus, which can lead to a vulvar, cervical, or anal cancer. HPV is also the cause of some cases of cancer of the mouth and throat. HPV in the genital area can be transmitted to the mouth and throat through oral sex. Warts on other areas of the body, such as hands and feet, are not spread by sex. The types of HPV that infect the genital area are spread by skin-to-skin contact, primarily through sexual contact. This includes vaginal and anal sex, as well as outer course. HPV can be transmitted to the mouth by performing oral sex on someone who has HPV on their genital area. Most HPV infections have no signs or symptoms. Therefore, most infected persons are completely unaware they are infected, yet they can transmit the virus to a sex partner. Millions of people have HPV. For some, HPV can have serious complications. In women, HPV can infect the cervix and cause abnormal cells that can lead to cancer later in life. These abnormal cells can be detected during a pelvic exam by a healthcare professional, during a pap smear, Women at highest risk for developing cervical cancer are those who became sexually active in the mid-adolescent years and have multiple sexual partners. Studies have confirmed that HPV is the cause of cervical cancer. It is estimated that 12,710 women in the United States in 2011 were diagnosed with cancer of the cervix, and 4,300 died as a result of it. HPV can also cause cancer of the labia, penis, and anus. Risk factors for anal cancer include having anal sex. Anal cancer is treated with surgery and/or radiation therapy. Cancer of the penis is rare. Although you may get HPV as a teenager, the cancer does not develop until adulthood. The most effective way to prevent HPV is abstinence from all forms of sexual activity. Condoms, again, decrease the risk of infection with HPV, but the degree of protection is not known. Vaccines are now available for males and females that reduce the risk of being infected with HPV and decrease genital warts and cancers. Discuss the HPV vaccine with your parents and guardians. If you don't have sex, you don't have to worry about getting genital HPV. Like the previous diseases we have discussed, if you do not engage in sexual activity, you don't have to worry about getting genital HPV. Many people have heard the terms HIV and AIDS but may not know what these abbreviations mean. HIV is human immunodeficiency virus, the virus that causes acquired immunodeficiency syndrome, or AIDS. HIV infects and attacks CD4 plus cells in the immune system, often leading to AIDS. HIV can be found in blood, semen, vaginal fluid, and breast milk of those who have been infected. When people get infected with HIV, it usually does not cause them any problems for months or even years. They may look healthy, but are infected with the virus and probably do not know it. They can pass it on to someone during sex. HIV slowly attacks the body's immune system. The immune system fights infections that make us sick. If a person's immune system is not working properly, the body cannot fight off even a simple infection caused by bacteria or viruses such as the flu, cold, or an ear infection. Most people who have HIV do not develop AIDS for years. The average time between getting the virus and developing AIDS is about 10 years, but can be as short as a few months or as long as 20 years or more. Individuals may get HIV as a teenager, not know it because they feel fine, become sick as an adult, and find out they have AIDS. There's no cure for HIV infection and AIDS. There are medications that can slow down the effects of the virus, but the medications cannot rid the body of the virus. Remember, many people infected with HIV do not know it, but pass it to others during sex. The most common way to acquire HIV is by having anal or vaginal sexual intercourse with an infected partner. The virus can enter the body through the lining of the vagina, vulva, penis, anus, rectum, or mouth during sex. In the United States, HIV is most commonly transmitted through men having sex with men. The second most common way it is spread is when men and women have intercourse and one of them is infected. People who use illegal IV drugs, that means injecting drugs into a vein, and share needles can spread the virus in the blood in the needle, even if the blood is not visible. If a pregnant woman has HIV, she can pass the virus to her baby before or during birth or while breastfeeding. Because of diagnosis and treatment during pregnancy, the number of HIV-infected newborns has dramatically decreased. Because blood donors are continually screened for HIV, it is very rare today to contract HIV from a blood transfusion. Nearly all people infected with HIV through blood transfusions received those transfusions before 1985, the year HIV testing began for all donated blood. Based on the UN AIDS report, there are 2.6 million newly infected persons, with 33.3 million estimated to be living with HIV. Approximately 1.8 million deaths related to HIV occurred in 2009. According to the CDC's HIV/AIDS surveillance report for 2009, there were 34,247 reported new cases of AIDS in the United States. There are medicines that can slow down the virus, but they cannot eliminate it from the body. There are other treatments that can prevent or treat some of the illnesses associated with AIDS through the treatment, though the treatments do not cure AIDS itself. As with other diseases, early detection offers more options for treatment and preventative health care. There is no vaccine to prevent HIV or AIDS. Once a person begins to develop immune deficiency and is started on antiviral medications, they must take them for the rest of their lives. The medicines are very costly, have numerous side effects, and must be taken exactly as prescribed, since the HIV can become resistant to the drugs. The World Health Organization recommends antiviral medications be started when the CD4 plus cell count is greater than 350, or when symptoms are evident. You can protect yourself by not getting involved in illegal drug use. Studies have confirmed that condoms do greatly reduce the risk of HIV by approximately 80%, but only if used correctly and consistently with every sexual intercourse. However, consistent and correct condom use is not the norm despite years of condom awareness and education. Abstinence from sexual intercourse and IV drugs are the only methods that are 100% effective in preventing HIV. If you're having sex, you must use a condom correctly every time you have sex. Like the slide says, if you don't have sex or use IV drugs, you don't have to worry about getting HIV. You will not get HIV by donating blood. When you get blood at a blood center, clean, disposable needles are used and never reused. There are 4 major concepts to remember about STDs. First, STDs can cause serious health problems. Second, most people who have STDs don't know it and can pass them to their partners during sexual activity. Third, you can get an STD the first time you have sex. Fourth, if you have had sex, you should go see a healthcare professional. If you are unsure where to go, talk to the school nurse or counselor. Abstinence or not having sex is 100% effective if used consistently and correctly. Condoms reduce the risk of getting an STD if used consistently and correctly. And there are vaccines that prevent infection from the common types of HPV. In order to get pregnant, intercourse with ejaculation must take place within a day or two of the female ovulating. The egg that is released can only be fertilized within a day or two after ovulation. However, STDs can be transmitted by an infected person any day of the month. Since 1 in 6 couples gets pregnant during their first year of condom use, it is obvious that condoms can fail when it comes to preventing pregnancy, particularly when only a small window of opportunity exists to get pregnant. Considering this, how effective can condoms be in preventing STDs, which you can get any day of the month? Not having sex is the only 100% way to prevent the transmission of STDs or getting pregnant. If you're having sex, you must use a condom every time you have sex. Condoms do greatly reduce the risk of pregnancy and HIV if used consistently and correctly. It must be understood that this protection is not 100%. If adolescents choose to become sexually active, they must understand that consistent and correct condom use is essential and critical to reduce but will not eliminate their risk of pregnancy, HIV, and other STDs. Condoms have the highest failure rate of the popular methods of birth control. To reduce the risk of pregnancy, it is best to use condoms plus a hormonal method of birth control. Although condoms are not 100% effective, partial protection can substantially reduce the spread of STDs, especially HIV. Sexually active teens must have regular checkups to be tested for STDs. The CDC recommends at least every year. Most people with STDs do not have symptoms and are not aware they are infected. The only way to know if you have an STD is to be tested. If you're having sex, you must use a condom consistently and correctly every time. Despite the fact that you're constantly bombarded with sexual messages on TV, movies, music, magazines, and on social media, the number of teens having sexual intercourse is decreasing and the teen pregnancy rate has been declining. Not everyone is doing it, regardless of what it seems. Virgins are now a majority in the U.S. high schools. Sex is not bad. It is, however, an adult activity with adult responsibilities and consequences. Those consequences include physical, legal, and emotional troubles. You also have the right to say no if being pressured to have sex. Abstinence means choosing not to have sex. Abstinence is the healthiest choice you can make as a teenager because you will not have to worry about STDs or pregnancy. If you have been sexually active in the past, it is never too late to stop and remain abstinent from this day forward. This is known as renewed abstinence. It's never too late to make the choice to wait. Teens who choose abstinence can set a great example for others. As a teen, you can talk to other teens and encourage them to remain abstinent. You need to set expectations and limits for yourself before it becomes an issue. Make sure you voice those limits to friends and dates. Everyone wants to be loved and have good relationships. By choosing abstinence, you are giving yourself the best chance possible to achieve this goal. Don't settle for less. You are worth the wait.